Hello there, my name is Charlotte Chapman and I'm a physiotherapist. Today I'm going to talk to you about how to retrain your pelvic floor muscles. Our mission for today is to make sure that soon after your diagnosis you know how to work your pelvic floor muscles correctly. The key word here being correctly. There is a bit of a knack to getting your pelvic floor muscles to work effectively, and I'm going to teach you that today. So why is it so important to do pelvic floor exercises when you have prostate cancer? Prostate cancer itself and prostate cancer treatments can cause pelvic floor weakness. Common symptoms of a pelvic floor weakness include incontinence throughout the day, ranging from small dribbles to larger accidents. You might have incontinence when you laugh, cough, sneeze, push or pull a heavy object. We call this stress incontinence. You could experience urgency to get to the toilet. When you need to go, you need to go. Dribbling after you go for a wee means that you're struggling to empty the bladder fully, needing to wee more often during the night. And some people also experience symptoms of erectile dysfunction. What does the pelvic floor do? It supports the pelvic organs and your posture. The pelvic organs include the bladder, the bowel, and the prostate gland. The pelvic floor also plays a huge role in being continent and helps to avoid becoming incontinent, and it also helps with erectile function. So where is the pelvic floor located? Now this is a more technical slide, so time to focus. Remember, you can pause the video and rewind it and re-watch it as many times as you need to understand this fully. So, this is a picture of some of your main abdominal or core muscles as they're also known. You can see from the picture that the diaphragm, which is your major breathing muscle, is at the top and it is shaped like a dome. As the name would suggest, the pelvic floor is at the bottom in the pelvis area. It attaches from your tailbone to the pubic bone and is shaped like a hammock, which is the opposite to the diaphragm at the top, which was the dome. Then there are some muscles that run all the way up the spine, and there are some very deep muscles that wrap around your middle. All these muscles you can see in this picture work together in harmony to enable your core muscles to support you and provide strength. The domed diaphragm and the hammock-shaped pelvic floor can affect each other greatly. Now take a look at the picture on the left. When we breathe in, the diaphragm, which is in purple, flattens, so it is no longer its dome shape. This flattening of the diaphragm causes the abdominal cavity, which is in pink, to push down and out. And it also causes the pelvic floor, in green, to be pushed down as well. In short, this means that the pelvic floor cannot engage as effectively when we take a big breath in, because the abdominal cavity is pressing down on it. Now look at the picture on the right. When we breathe out, the diaphragm, in purple, returns to its dome shape, which in turn draws the abdominal cavity, in pink, inwards and upwards, which then allows the pelvic floor in green to lift. This means we can engage our pelvic floor muscles really well when we breathe out. This is complicating stuff, I know, but stick with me. Once you've practiced your breathing for a few weeks, it will all make more sense. And you might find you need to watch this video a couple more times to register this information too. Let's look at the pelvic floor itself in more detail. In this picture, you can see lots of different organs in the pelvis. The bladder, the bowel, the prostate gland, and the pelvic floor, which again, you can see it shaped like a hammock underneath the bladder and the prostate gland. Can you see how the tubes coming from the bladder, also known as the urethra, and the bowel go through the pelvic floor muscle? If you have a healthy pelvic floor muscle, the muscle will be nice and toned, providing support around the urethra and the bowel. If your pelvic floor is weak, you will find you will have more problems with incontinence, as there is less support and muscle tone around the urethra and the bowel. Now, what if I've had, or am going to have, a prostatectomy? Above and below the prostate gland, there are some other muscles called sphincter muscles, and these muscles are circled in the picture. These muscles are controlled by the brain. We can't actively engage these muscles by ourselves. Only the brain can tell these muscles when to engage and release. So when we're trying to hold our bladder, when we don't want to go for a wee, these muscles are engaged. They're switched on. And when we get to the toilet and we want to have a wee, the brain automatically tells these sphincter muscles to relax and let go so we can go to the toilet. When you have a prostatectomy, the surgeon removes the prostate gland, but unfortunately there is also some trauma and possible damage to the sphincter muscles. So when the sphincter muscles are not working so well, we then rely on the tone and strength of our pelvic floor muscles to help control when our wee leaves the bladder, not the sphincter muscles. So how do I get my pelvic floor working? So there are a couple of funny but very effective analogies. So that feeling of jumping into a cold sea, when you walk into the water and the cold water reaches the level of your scrotum and you get that feeling of lift, that is your pelvic floor contracting. When you engage your pelvic floor muscles correctly, the penis should shorten and lift, or nuts to guts, as this squirrel might say. So, joking aside, technique is important. I'd like you to try for me now to imagine that you are desperate for a wee. Try and get that internal feeling of lifting to stop yourself having a wee. Imagine you're on the motorway and there's not a services for a few miles, so you have to hold. And now relax. Now try the opposite end. Imagine you need to stop yourself passing wind. Tighten up around your back passage. You don't need to squeeze your whole bottom, just around the back passage. Imagine you're in public and you really can't pass wind. Keep holding. Good. Now relax. Now, I want you to try those two things together. Imagine you need a wee, and you also need to stop yourself from passing wind at the same time. So you're in a bit of a pickle really, aren't you? And now breathe whilst you do it. And relax. It's hard to breathe, right? So try another time to engage both at the same time. And try to breathe this time too. So try that now. Engage at the front as if you need a wee. Engage at the back as if you're stopping yourself passing wind at the same time. Keep breathing. That's it. Excellent. And relax. So when you engage your pelvic floor, I want you to try really hard not to do any of the following things. You don't need to squeeze your whole bottom. You don't need to hold your breath. No raised shoulders or eyebrows, and you definitely don't need to pull a funny face. Once you've practiced these exercises more, and it's all starting to feel a bit easier, you should find you can practice these exercises anywhere and everywhere. When you're stopped at a red light in the car, when you're in a queue at the shop, or while you're out walking. It's really important that you vary your pelvic floor workout. Just like you would if you went to the gym. You'd do a bit of cardio, some weights, some stretching, and then a relax at the end. With your pelvic floor muscles, you want to practice power contractions, and this is where you engage the pelvic floor as much as you can, and then release as much as you can. And we do this with some good breathing. Speedy contractions, where we engage and release as quickly as we can. Endurance contractions, where we engage and hold for 10 seconds while still breathing. And there's also a technique called the knack, which I'll come to in a moment. So let's try together to do some power contractions. So I'd like you to stand up for me. Get yourself nice and comfy, stand up nice and tall, and when you're ready, I want you to imagine you're stopping yourself from having a wee and stopping yourself passing wind, and I want you to make that contraction as strong as you can. So you're trying to engage as much as you can. And then when you're ready, I want you to release all the way. So you completely release at the end. Good, try that one more time for me. So, engage as if you're stopping yourself having a wee and you're stopping yourself passing wind, and engage as strongly as you can, and then release fully. Good. Now, I'd like to try this with some breathing. So, I'm going to ask you to breathe in to begin with, and when you breathe in, you don't need to do anything, you just need to relax. So we're going to breathe in and relax. And then as you breathe out, I'd like you to do that nice powerful pelvic floor contraction. So we're going to breathe out and imagine we're stopping ourselves passing wind and stopping ourselves having a wee. Good. Breathe in, relax. Breathe out and engage. You need a wee and you're stopping yourself passing wind. Breathe in, relax. Breathe out, engage as much as you can. Breathe in, relax. Breathe out, engage as much as you can. One more time. Breathe in, relax. And breathe out, engage as much as you can. Excellent. Have a sit down for me. Now, it's quite normal when you first start doing big breathing exercises that you may start to feel a little bit woozy. So do take it easy if that's the case. I'd like you to practice these powerful contractions 10 times, and I'd like you to do them 3 to 6 times a day. If you've just had a prostatectomy or are having a worsening of your pelvic floor symptoms due to having some treatment, I'd like you to do these exercises 6 times a day. If you're just looking to maintain your pelvic floor or just get it a little bit stronger, but there's no major issues, 3 times a day will be okay. There are some ways that you can make this feel a little bit more relevant for you. If you feel when you do your pelvic floor contraction that you can't really feel the back passage very much, it feels like you can stop yourself having a wee, but you find it quite hard to engage at the back end, what you'd want to do is stand with your toes turned out. And then you do the exercise exactly the same, and just having those toes turned out will activate the back passage more. And you can do the opposite if it's the other way round. So if you feel like you can engage at the back end, okay, but actually when you think about stopping yourself having a wee, that's when you feel that it's not as strong. Stand with your toes slightly turned in and do the exercise like that. And you should find that that activates at the front more. If you have no issues and both techniques feel relatively the same, so you feel like you can engage at the front end and the back end okay, then feel free to stand with your toes pointing straight forwards. Speedy contractions. Now we still want to use the same amount of power as we used in the powerful contractions, but as the name would suggest, we are now going to speed up our workout. So what I'd like you to practice, and you can do this in sitting or standing, I'd like you to practice engaging your pelvic floor fully, nice and quickly, and then releasing nice and quickly. Engage, release, engage, release, engage, release. Good. So it's the same as before without the breathing. You're breathing normally now, but you're trying to go as quickly as you can. And you'll find as you get stronger that you'll get quicker and quicker. Just make sure that you're doing both parts of the exercise. You're doing the engage and you're doing the release. It's important that you do both. Again, I'd like you to practice these 10 times, and I'd like you to do it 3 to 6 times a day, depending on what your goal is with your rehab. A nice way to keep track of your progress is to time how quickly you can do 10 contractions. And maybe if you timed this once a week, say, you might start to notice your improvement as the weeks pass by. Now we're going to try some endurance contractions. Now these are slightly different. I need you to think about the difference between a sprinter and a marathon runner. So far, the powerful contractions and the speedy contractions, we've acted like a sprinter. We've done really powerful contractions because we're only doing them for a short period of time. Now, if we were running a marathon, we'd need to pace ourselves a little bit more. We wouldn't put in quite as much effort so that we'd be able to run for longer. And it's the same with your pelvic floor. When you do an endurance contraction, you contract to only about 30% effort. Now, this doesn't need to be exact, but I just want you to get the feeling that you're putting in less than 50% effort. Okay, so let's try this together. Get yourself nice and comfortable, and I want you to have nice posture again, sitting up tall or standing up tall. Just very gently start to engage the pelvic floor, as if you need a wee, as if you're stopping yourself passing wind, but only to about that 30% effort. You know you could engage the pelvic floor more if you wanted to, but because we're doing an endurance hold, you're only going to engage to that 30% effort. And relax. So now we're going to try the same thing. Please remember to breathe. And when you're ready, we're going to try and hold for 10 seconds. Okie doke. So nice posture. Gently start to engage the pelvic floor just a little bit and hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and release. Good. Now, did you get to the full 10 seconds? Did you feel at the end of the 10 seconds that there was a release? If you didn't feel a release at the end of the 10 seconds, it might be because your pelvic floor let go earlier on. So don't worry if you can't get to the full 10 seconds, it just means you need to keep practicing. Let's try again together now. So engage your pelvic floor very gently, just to about 30% effort. Keep breathing and hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release. Good. Now just a tip for you. If you're struggling to keep breathing whilst holding, why don't you try counting out loud? The simple act of talking whilst you're doing the exercise will encourage you to breathe. So let's try one more time together, and you could count in your head or you can count out loud with me. Engage your pelvic floor nice and gently and hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then completely relax the pelvic floor. Good. Now just like the other exercises, we want to do 10 of these exercises 3 to 6 times a day. The knack is where you use your pelvic floor in everyday activities. Activities such as laughing, sneezing, lifting, pushing, pulling, standing up from a chair, a squat. Those activities all put increased pressure in our abdominal cavity. And when there's extra pressure in the abdominal cavity, that pushes down on the pelvic floor. So, if you experience symptoms whilst doing any of these activities, so for example, if every time you cough you have a little leak, try and engage your pelvic floor whilst you cough. And the same with, say for example, standing up. If every time you stand up from your chair you have a little leak, the next time you go to stand up, try and engage your pelvic floor for me, just like we've been practicing before. So you imagine you need a wee and you're stopping yourself passing wind as you go to stand up. Practicing your pelvic floor muscles in this way is called the knack. And my second pelvic floor exercise video works on this a lot. So the exercises in summary. There are 4 different ways to work your pelvic floor. You want to do powerful contractions, endurance contractions, speedy contractions, and that technique called the knack. The powerful, the endurance and the speedy contractions, you want to do 10 contractions each time you do your exercises. And you want to practice your exercises 3 to 6 times a day. The more you practice, the quicker you're going to see results. So get practicing now. So you can start doing these exercises straight away, now that you know how to do them correctly. When you start a new exercise regime, it's all about getting into the habit of doing these important exercises. A nice way to get into the habit of doing them is to link doing the exercises with activities. So for example, you might like to link them with doing your teeth and your meals. So every time you clean your teeth or you have a meal, breakfast, lunch and dinner, you do your pelvic floor exercises. You might like to link them to your toilet visits. So every time you wash your hands, you do some pelvic floor exercises. You could set a reminder or an alarm on your phone, or a family member could encourage you to do them as well. There's a great app called the Squeezy app that is powered by the NHS, and that app, there's a male and a female version, so make sure you get the male version. It guides you through the pelvic floor exercises and also sends you reminders to do them. So this is a brilliant app, and I think it costs $2.99. I think it's worth taking a few moments to talk to you about normal bladder and toilet habits. So we are encouraged to drink 1.5 to 2 litres of water every day to keep our bodies nice and healthy, to keep our bladder healthy and our body. if you drink this recommended amount of 1.5 to 2 litres of water, you should find that you go for a wee every 3 to 4 hours. Now, people with prostate cancer will probably go to the toilet more often. Some of this is because of the prostate cancer itself, but quite often it's due to a pelvic floor weakness. And sometimes it's even due to anxiety. So you should find, as you practice your pelvic floor exercises more often, that your pelvic floor gets stronger and you start to be able to go to the toilet less often. If you feel like you go to the toilet more often because you're anxious about having an accident, what I would like you to do, if you can, is to try only going to the toilet when you actually need to go. Try to avoid going to the toilet just in case, as this only weakens the pelvic floor and the bladder muscles. Think of it as weightlifting for the bladder and the pelvic floor. If you always go for a wee when your bladder is only half full, your pelvic floor will only ever get used to lifting or holding a half full bladder. So what you should find as the pelvic floor gets stronger and as you start to practice going to the toilet less often, avoiding those just in case visits, that your bladder slowly gets used to and your pelvic floor slowly gets used to holding 3/4 of a bladder and then a full bladder. But this does take time, so be patient and keep practicing those exercises. Now, if you feel like you're doing your pelvic floor exercises and you're trying to avoid going to the toilet just in case, you're really trying hard to space out your visits to the toilet, but you find that your bladder is still very urgent and it's misbehaving still, you could try to avoid caffeine, fizzy drinks, fresh fruit juice and alcohol. This doesn't mean that you can't ever drink these things, but it's just something to consider if your bladder is still very urgent and you're having some accidents because of it. You could try avoiding those things. Carry on trying to avoid just in case visits to the toilet. That will help. That will help to strengthen your bladder muscles and your pelvic floor. And other things you could try are distraction techniques. So you could do some breathing, some nice mindfulness breathing. If you sit with your legs crossed, that will help activate the pelvic floor muscles. You could tap your feet, contract your pelvic floor, do a round of your pelvic floor exercises. That might help you hold your bladder longer. And also distraction things like doing something completely different, doing a puzzle, doing a Sudoku, something else to take your mind off needing the toilet. Making some positive, healthy lifestyle changes can also really help your pelvic floor and your prostate cancer rehab. Exercise is a fantastic thing to do. Not only does it produce endorphins, which make you feel happier, but it also helps to promote good muscle tone, and that includes the pelvic floor. Research has shown that people who do a brisk walk for 30 minutes 5 times a week have good pelvic floor tone. Those of you on hormone treatment, exercise such as walking, weight-bearing exercise, is really good for your bone health. So walking is absolutely perfect. So get those walking shoes out and go for a nice walk. I've also put together 3 exercise videos for you to help you practice your pelvic floor exercises. Healthy nutrition can also really help your pelvic floor. Drink plenty of water to keep your bladder nice and healthy, and try to avoid constipation. Constipation can cause you to strain, and when we strain, that puts a lot of strain on the pelvic floor as well. So drinking plenty of water and maybe adding in something like flaxseed to your diet could help to avoid constipation and help your pelvic floor feel better. If you're a smoker, please do try to cut down or stop smoking completely if you can. Smoking really affects your healing, So if you're about to have a prostatectomy, your body will heal quicker if you don't smoke. If you're on hormone therapy, the hormone therapy can reduce your bone density, and smoking can also do this too. So it is a good idea to try and cut down or stop your smoking if you're about to have an operation or if you are on hormone therapy. Thank you for listening to this presentation. I hope you found it really helpful, and please remember you can listen to this presentation as many times as you like to make sure that you really understand the information we're giving to you. You can now join me for 3 online pelvic floor exercise classes. In these classes, we're going to be doing more pelvic floor exercises, so we'll put what you're learning now into practice. You'll find that your posture will get better when you do these exercise classes too. We'll also be doing some weight-bearing exercises, which will help strengthen your bones. And hopefully, you'll have lots of fun too. So, take care of yourselves, and I look forward to seeing you in the exercise classes soon. Take care. Bye. This presentation was brought to you by Charlotte Chapman of Physio and Pilates in Motion. Thank you.